Okay, so we're getting started here. So this week's question from the community, it's mostly Instagram, but I don't know if you can see it on YouTube and Facebook, but it's, I guess the way the camera's positioned. What's in the background? So in the background are some pop figures. If you can't see Instagram, their 40th anniversary Empire Strikes Back. So we have Vader in the meditation chamber. We have Yoda and Dagobah. No, Dagobah Yoda, who's a bobblehead. Luke on a tauntaun. Luke with Yoda. Frodo and Doctor Strange. Those are the pop figures. And of course we have Baby Yoda, but you can't see him right now because of the camera. So there's Baby Yoda. All right. So today we're going to kind of conclude the whole women's health webinar. And we're going to conclude with my experience. So 20 years of experience is going to be in the format of some case studies where early on we saw some conditions and what we learned from it and how we can apply it in a patient-centered way. So if you remember in the beginning, we said we are patient-centered, where we talk to the patient, we communicate with the patient and get some information. We are evidence-based to show that everything that we've done here is to some degree backed up by some form of science, whether it be basic scientific studies that I like or randomly controlled trials, which also meta-analysis and reviews are a good way. They take all the studies that have been done and look at them and dissect them and basically come to a conclusion that things are generally beneficial, especially in acupuncture. And then the 20 years of experience. So the first case study we're going to talk about was one of the first ones I treated when we first started practicing. And this was a patient, she's 25 years old at the time, was told that she was not going to get pregnant. Okay, and she was absolutely devastated, but didn't want to take no for an answer. And she started treating, but she was treating with my wife, and I would treat her too because my wife and I were practicing together. And the case with this young lady at the time was that she had not had her period in 2 years. Okay, well, actually longer, 4 years. As a child, she was told she was overweight. So she kind of went overboard with the fitness and kind of lost her cycle because as you exercise, you raise the levels of testosterone and they take over and throw off your cycle. It's called exercise-induced amenorrhea. It's basically when you lose your period due to physical activity. So that's an increase in testosterone that kind of throws off, just the menstrual cycle. Part of it was trying to change and kind of come out of that and say, you really can't exercise that hard anymore. It's hard to change those habits. But after about 2 years with herbs and acupuncture, we brought the period back and she ended up getting pregnant. So this set the pace to say that everything revolves around the hypothalamic pituitary ovarian axis. Like she was told you were not going to get pregnant. And frankly, I don't like to hear that. And I won't take no for an answer. Neither did she. And she ended up getting pregnant. The second case is we have a 37-year-old female who's a little bit up there in age, as she was told. She was too old. She was doing IVF. She was doing IVF at Cornell Weill Institute. To save some money, she was enrolled in like a pilot program where we were studying her process and evaluating her. She was getting frequent blood tests. And I remember her telling me that she was, she was reporting back to all about her hormone levels. I remember her telling me that exactly say, my LH is normal now, where it wasn't, and the only thing I'm doing is acupuncture. So she was going through the protocol. She's trying to save some money. She was getting a grant to do the IVF. And she was going through it. And then unfortunately, at some point, I lost track of her and I didn't know what happened. And I was calling. And of course, when you're a practitioner, you don't hear from a patient you're seeing all the time. You kind of get worried, like, did I do something wrong? Does my breath sting? You don't know. I was really kind of like thrown for a loop. But then I hear from her about 3 months down the road, or 7 months down the road. And she calls me up to tell me, you know what? I got pregnant and I wanted to thank you. You were helping me. What had happened is that she went back to her doctors that were doing the IVF and they told her the pregnancy was ectopic and they wanted to terminate the pregnancy. And she went immediately and followed up with her gynecologist. And her gynecologist said, you know what? Everything's fine. Stop seeing everybody, including me. And she called back to thank me to say that whatever we did was really helping her, but it was the doctors who were doing the IVF that were trying to sabotage what she was doing. And her doctor intervened, her gynecologist, and said, no, you're going to stay home and you're not going to talk to anybody. Ended up having a girl, and she called me, and that was actually really good because, you know, when you get feedback from your patients about their hormone levels, you kind of feel like you're doing something. 36-year-old female. This woman who had a baby before was unfortunately experiencing multiple miscarriages. And she was told, she was diagnosed with infertility, even though she had a child. They were calling her infertile, which was, you know, absolutely incorrect, because if you're infertile, you can't have children, but she had done. She did have children. So we treated with her 8 months. And a lot of times with frequent miscarriage, it's about egg quality, right? If you're not producing eggs and the genetic material is a little iffy, the body will kind of get rid of it. It's not all bad news. Yes, it's terrible to suffer a miscarriage, believe me, especially late stage. But early on, chemical, or what we call chemical pregnancies, the good in that is that you can actually conceive. If you take our first case, we were talking about, she had not gotten pregnant. She was unable to conceive. That's a lot of work to get to where you are. You're at least able to kind of have a chemical pregnancy. What we need to do is focus on egg quality, and egg quality is what we did. And what I tell my patients is that we need like a line in the sand. We need a marker, right? An egg to develop takes about 120 days to kind of come out of the ovary and get fertilized. So if you had experienced the system body shock of a miscarriage, that's kind of heavy for the body to take in. It's not advised to try again right away. You got to give yourself a break. And the unwritten rule amongst cultures is about 6 months. So if you take that 6 months and you take the 4 months and say, all right, from this point on, we want to work on egg quality, it's about 120 days. So I give people after that, because we treat for miscarriage a lot. We say, you know what, let's just take 40 days, 120 days, 4 months, and just focus on egg quality. And we'll do that, and we'll treat once a week usually. And it's not carved in stone. You can miss a couple here and there. But the fact is, there's also herbs involved. We do herbs for egg quality. And I know we didn't discuss herbs too much, but we may be once we do this over again. But with the herbs and the acupuncture, the egg quality improves. In about 6 to 8 month mark, the patient ends up getting pregnant, and everything's fine and everything's dandy and there's no issues. But it is something horrible to kind of experience, and there is a level of counseling to explain. Yes, this is terrible. It's unfortunate, but we have to kind of make lemonade out of lemons and at least acknowledge the fact that you can get pregnant. We just have to work on egg quality. So that's frequent miscarriage. 42-year-old female was coming to me because she was going through menopause. She was having hot flashes. She had missed a couple periods. She skipped, but also had a period in about 2 months. So she felt like this was it. That was the end. But the main treatment was for hot flashes. And I remember speaking to her and talking to her. She was married. She didn't have children. She was very, sort of like despondent about that. And was, her girlfriend talked about it with her husband. And as we were treating her for the hot flashes, she ended up getting pregnant. Why? Because we were regulating the hypothalamic pituitary ovarian axis. That's that sort of low ovarian reserve, that state of hormonal imbalance or perimenopausal state that women go through. It doesn't mean it's the end. It means we need to work on balancing it, and we know we've talked about it enough here to say that acupuncture does regulate it. So if you're 42, you're not too old to have a baby. If you're having perimenopausal symptoms, it doesn't mean it's the end of the road. We just need to work on it. And I'm glad to do it with people. And it's worked multiple times. And also, if you're, higher up in age, as a woman, you're experiencing hot flashes, and we're treating the hot flashes and we're regulating the hypothalamic pituitary ovarian axis, be careful and use protection, because you may want a child in your 50s or your late 40s. But, just be aware that that's a possibility as we start treating that you could get pregnant again. Final case. So this case is the nearest, dearest to my heart. This is the case I use to counsel all my patients, to tell them that if you try and keep trying and stick with it, over time, you will get pregnant. Okay. This person, of all people, had to do IVF because this patient had had a cervicectomy for some reason. They removed the cervix, and there was just no way that she was going to get pregnant through natural means. And she was all right with that. And everybody's fine. We don't take a hard line here. Let's emphasize this point one more time. I do not care what you do. IVF, IUI, donor eggs. I'm not here to tell you what to do. I'm just here to tell you that with acupuncture, we can help you. We can regulate. Should you not want to do IVF, right? Let's be proactive. Even if you want to do IVF, okay? Let me help you get to the state where you don't have to do 5 or 6 IVFs. Let me get your body ready for the IVF. And chances are you will get pregnant before the IVF, right? But there are situations where you will need to do IVF. So women who have had not hysterectomies, but have their tubes tied, women who have tubal abnormalities or have no ovaries or one ovary or damage to the fallopian tube where the egg can't get to. There are times where you need assisted reproductive technology and IVF. So this was one of those cases. But one of the problems was we kept treating. This person had 9 failed attempts. I was along with some of them. I think maybe around the 7th, she decided to take on acupuncture, and we were trying to help her. We were trying to help with the egg quality. But, as she was 49 years old, we had to kind of be realistic and say, you know what? Maybe this isn't going to happen. And I felt like at one point that I couldn't really help her. But what the feedback was is that the acupuncture wasn't really directly helping with the process, right? I like to think it was, but she just felt better, calmer, and overall at ease doing acupuncture to help her through the process. So it's not about ovaries. It's not about uteruses all the time. It's about just taking the pressure off, right? The whole process is devastating. It's mentally taxing. And sometimes you just need a little bit of relief and some space to heal. And that's what was happening with this patient. And I was fine with that. If I can help you in any way, I will help you. And there's actually evidence to show that acupuncture does help with the stress. And when you're going through this process, it's stressful. So eventually she decided to do donor eggs, which is fine. Also, you can do donor eggs, perfectly fine. But unfortunately, the same thing that was happening with her own eggs, she was failing 1, 2, 3 times with donor eggs. So what happened was we finally got her on the 11th try, right? She got pregnant, right? At 50 years old with no cervix in IVF, this patient was able to get pregnant. So when you tell me about, or I hear that you can't get pregnant or you're having trouble, I always refer to this story and I say, if you try hard enough, if you believe in the process, you will get pregnant. Period. That's what I've seen. I've treated enough people to know that if you just stick with the process long enough, you will get it. It's harder to see that when you're going through it and you're suffering the effects of the disappointment, right? And internalizing the disappointment. But if you stick with it long enough, it will work. And at the end of the day, and I just want to kind of wrap it up here, there's really nothing wrong with adoption too. Like that's an option, but people don't bring that up. And the tricky part with donor eggs too, and this is something that this is another classic clinical pearl of wisdom that I like to share with people. Like, even there is an emotional baggage with donor eggs because the mother whose eggs that were using foreign genetic material feels like it's not her child. And I want to be very clear because people talk about, say, oh, epigenetics, it's boring, it's this and that. No, epigenetics is important because when you take a foreign egg and you put it into another person's uterus, that egg develops in that environment with that genetic material from that uterus. So let me backtrack. So somebody else's egg in another person's uterus will take on that genetic material of the carrier. So if we're splitting here, as to say, like we're half us and half our parents, everything that separates all humans is about 0.01% of genetic material. So if we split that in half and say it's 0.005 or half of 0.1%, right? You're contributing to that material. So now what are we splitting that further to 0.00025%? You're still contributing. You're still contributing to that material, and it's your child. It's your baby. The tricky part is what happens when. Sorry, I think I'm having a problem with Instagram. Okay. Anyway, we'll just continue going on. What happens is when you start sourcing eggs locally from a lot of donors, there comes a problem where there is a possibility where you may have a half sibling So if people are doing donor eggs close to New Jersey and they're getting those eggs close to New Jersey, there is a possibility that you may run into a sibling down the road. So just be aware of that. That's something that needs to be addressed. But you don't have to feel bad about using donor eggs, because if it's developing in your own uterus, you are contributing that genetic material. So it is your child. It's actually complicated a lot of surrogates, cases with surrogacy where the surrogate actually has a claim because it's their own genetic material. So with that being said, I'm going to conclude this portion. I'm done with the whole webinar. We may run through it again just because we're trying to get it ready for a webinar down the road. And again, thanks for listening. More feedback, even if it doesn't have to do anything with acupuncture or women's health. But yes, the pop figures are the 40th anniversary Star Wars. Thank you.